Good morning, everyone. First of all, I would like to thank you for coming to this session and also to say what a pleasure it is to share this panel with such distinguished, not only colleagues, but may I add, friends here at my side. So this work that was done is about the compulsory license and access to medicines and the economic savings of the compulsory license of Efavirenz in Brazil. This was a work that was done together with two other colleagues of our Department of STD and AIDS, Andre Rodriguez and Ronaldo Halal. And also I would like to add that this work wouldn't be possible without the contribution of the people of the Ministry of Health that has worked in the compulsory license process in 2007, and also the civil society groups, not only from Brazil, but across the world, that has pressure and has added support to the adoption of this measure in Brazil. So, as you know, since 1988, Brazil has enacted in his constitution health as a citizen's right and a duty of the state. And also, as highlighted by our director yesterday, Brazil is one of the few countries in the world that has a universal health access system for more than 100 million patients and inhabitants, free of charge for everyone. So that's important also to highlight in every presentation. And ever since 1996, Brazil has enacted an universal law, access law to ARVs. So ever since 1996, Brazil provides free of charge universal access to antiretroviral treatment. And this Brazilian response has been strongly supported by the civil society groups for our national response. So the main results were only possible through this cooperation as well. And ironically, at the same year that we have enacted the Universal Access Law in Brazil, we have also established the Industrial Property Law that has established patents for pharmaceutical compounds, for pharmaceutical products. Prior to this legislation, Brazil didn't provide patents for pharmaceutical products, only for processes. Just a little bit of background of Efavirenz. That's the product that the ARV focused on this presentation. It was patented in 1996 in Brazil. It is a pipeline patent that recognizes patents retroactively. It's a TRIPS Plus mechanism. It is a patent that should not have been granted by Brazil, but our legislation allowed this measure. The main patent for Efavirenz expires in August 2012, so a few days from now. And in 2007, when the compulsory license was issued, we had 75,000 patients on treatment of Efavirenz in Brazil. So just to highlight some of the background as well, we had more than 8 price negotiation meetings with the patent owner, and they initially offered a price of $1.59 US per pill. And at the end, the last offer that they made was a price reduction of 30% of that price. That was around $1.11 per pill. However, at the same time, the patent owner was offering to Thailand the same product at $0.65 per pill, 65 cents per pill. Brazil has considered this unacceptable because we have a broader range of patients on treatment, and the patent owner has provided a lower cost for Thailand and not to Brazil. And this slide just to highlight some of the legal framework behind the compulsory license process. In April 24th, we had an ordinance from the Ministry of Health that has declared Efavirenz of public interest. In May 2007, there was the presidential decree that actually issued a compulsory license on the grounds of public interest and non-commercial use for the duration of 5 years, and with the payment of royalty fees for 1.5% of the cost of the finished product. This license obligated the patent owner to transfer the knowledge and information necessary to reproduce the patented medicine. And just it's important to point out as well that Brazil has reaffirmed this interest in issuing compulsory license not only for Efavirenz but in other products. Only this year we have renewed this compulsory license in May this year for efavirenz, and our President Dilma in other occasions has mentioned the possibility of using this mechanism for chronic non-communicable diseases in last year. So, but what is a compulsory license? Most of you know, but it's a license that allows the government to authorize someone else to produce the patented product or process without the consent of the patent owner through a payment of royalty fees, and it's one of the most important TRIPS flexibilities of the WTO agreement. It's not the only one, but it's one of the major ones. And in this graphic, we show a little bit of the trends and the reduction of prices through the compulsory license. It greatly shows that in 2007, when the compulsory license was issued, the price dropped from 2006 of around $45 million per year that we have paid through efavirenz to around $15 to $10 million per year. So this was a major price reduction in only 1 year. And you can see the increased number of patients that we were able to include for efavirenz. This is the 600 milligram presentation of the product, and how the number of patients has increased. And also this slide shows what everyone knows, that Brazil price of the national industry is not still as competitive as the Indian prices, but Brazil has enacted this and has started producing efavirenz since 2010 as a sovereign issue, and also to be one more tool to utilize when they want to issue a compulsory license, because we always have the threat that we can nationally produce such a product in Brazil and not only import it from international suppliers. So this, even though we pay a little bit more nowadays, we have an increase of patients, increase of quantities, and also we have a possibility of issuing a compulsory license wherever we want. And this graph only shows the evolution of the prices per pill of efavirenz as well. And you can see how the price has dropped from almost the half of the cost, 1/3 of the original cost from 2006 to 2007, and a little small increase afterwards because of national production in 2010. And also this other graph just shows a little bit of the differences, because in the economic savings in the total we have used not only for efavirenz 600 milligrams, but also for 200. And after the 600 milligrams was incorporated, there was a diminishing trend of use and an increased trend of use of efavirenz 600. And you can see also the increase of number of patients through this along the years. Just to highlight more precise figures, in 1999, when we included the 200 milligrams presentation, the cost was $2,500 per patient per year. In 2007, after the compulsory license, the price got to $259 per patient per year. And nowadays, we're still buying from international suppliers. This presentation, it is for $170 per patient per year. And the annual cost for the 600 milligrams, it's in 2003, $772 per patient per year, and in 2007, $158 after the compulsory license in the period that we bought from international suppliers. In 2009 and 2010, after the inclusion of national production, we have a price of around $279 per patient per year. And nowadays, in 2011, $294. So you can see the drastic price reduction after the compulsory license. And this other table highlights the total savings through this compulsory license, and where you can see the total amount of around $103.600 million. The total savings. And it's important to point out that included in the savings are already the royalty fees that we have already paid for the patent owner. So this is the same, this is the price already with the compensation for the patent owner of the compulsory license. So you can see that in a period of 2007 to 2011, a big saving of our national budget, because as I mentioned before, our entire response is based on national money from the national treasury. So doesn't come from international suppliers. And just to explain a little bit more, we have used as a reference price the last price offered to Brazil with the reduction of 30%. So that was the price that we have used for the savings account. And as I mentioned, the total reduction of savings with the compulsory license was 103,600,000. And this shows that we have saved 58.47% buying from generic suppliers. So you can see only one medicine, the amount that we have been able to save through this mechanism. But we have some challenges. International prices are still lower than the ones offered to Brazil, even of the patent owners and of the national facilities as well. As you can see, intellectual property is a significant element of prices of the medicines. Only through a compulsory license we have managed to save 60% of it. It is necessary the full use and implementation of such flexibilities as a compulsory license. And as another colleague mentioned yesterday, I believe I have a dream, I believe most of them share it, that the next AIDS conference and the presentation of Dr. Fauci, we can see intellectual property and TRIPS plus TRIPS flexibilities as a component of ending HIV epidemics and increasing access to medicine as an essential, crucial role for increasing access to medicine to the world. So for us, it's even contradictory that Secretary Clinton says that they're putting a lot of money into it, but they are also pushing for greater intellectual property protection across the world. So it's a little bit contradictory, and it's important to keep in mind this component of intellectual property as a price that influences the prices of medicines. And through this work, I believe Brazil has shown that increasing access is more important than economics. Even though this is economic savings, this is just to show how much more we can increase access to medicines and save money to add treatment on our patients. Thank you very much.